Hi, I'm Dr. Ahmed Al-Turki, American Canadian Board certified dermatologist and also a hair transplant surgeon, American Board of Hair Restoration Surgery. We are in Adama Center, Riyadh. Today I'm just giving an introductory for the hair transplant, some information basic that everybody should know. Before doing any hair transplant, they need to be a little bit educated how to treat and preserve. Basically, hair loss in men and women, there is a type called, which is the most common, called androgenetic alopecia or pattern hair loss, from 1 to 7 stages in men. Some of the type of the men also, it's called recession, from 1 to 5, and then maybe they transform to another stage, depends on when they started. As the younger they start, the more family history, the more worse it's going to be. For women, the different type, they usually preserve the hairline. Also 20% of men go to female pattern, especially if they got it from their mother's side. But in women, they tend not to go to the severe cases usually, but they need treatment and also a transplant in some cases. The donor area, it's usually in the back of the head, and it's usually limited. So it's a very limited resources. We have to be careful not to overdo it. So I'm against the overtaken from the area, especially people who are coming from abroad, Turkey and other areas where they do it with non-professional who do too much, and then we have to correct. Our patients here, up to 30% of our patients are just corrections. Either we correct by transplant or we do a scalp micropigmentation or SMP. The hair goes in different stages, from the longer one from 3 to 6 years, which is called anagen, then the resting phase for about 1 or 2 weeks, and then the falling phase, which is called telogen, about 5 to 6 weeks. Usually, but this constitutes about 16%, and the middle one, which is resting for about 2 weeks, and it's only about 4%, and 80% of the hair is growing actually. If we dissect the hair or pull hair actually, there are micros, which is 1 hair, 2 hairs, and 3 hairs, and 4 hairs. So the upper one is the skin, and the lower and the dotted one behind the cross is the bottom. This is called FUE, which is follicular unit extraction. With certain area, we just pull about 20%, the maximum we can do from any given area, which is the donor. There is another type called FUT, which is that means just removing a strip and suturing it or stabling it, and it leaves a linear scar. But this is more conservative and can be no need to shaving, and it's suitable for people who not covering their hairs.